Like about TMS is that it increases brain-derived neurotrophic factor. I'm sure you guys all hear me talking about this. It does increase brain-derived neurotrophic factor. Let's talk about why it's important, because BDNF functions. It actually increases neuronal survival after brain damage, TBI, stroke, those kinds of things. Even things like COVID, it can cause brain damage. It will damage the blood vessels in the brain. So BDNF comes in and gives it its ability to manage any kind of insult in the brain. Neurogenesis, what does that mean? It means BDNF is used to create nerve cells. So people who have a poor ability to create nerve cells is because their BDNF is somewhat compromised. TMS can come in and try to help them. And that's why this is an understanding why some people who had brain injury can do better post-brain injury versus others who may not, who still suffer from depression, cognitive issues after a brain injury. Migration and differentiation of neurons, meaning it starts with one, but then there are different kinds of neurons that we need in the brain. So BDNF is there to help guide what that neuron is supposed to be, depending on what part of the brain you are in. The growth of dendrites and axons, this is the most important. You can't just have one brain cell. They have to be connected to each other. They have to communicate via, not only through neurotransmitters, but through that electromagnetic field that we talked about. That is the principle behind TMS. So synapse formation, meaning the connection between one brain to another, there is what they call the synaptic cleft, and it makes sure that it does communicate with each other, and neurotransmitters are going through there from one synapse to another. So this is the other thing why I like TMS, especially in brain injury. BDNF is responsible for brain healing, meaning the concept of plasticity of the brain. So this is the reason why you may see people who've had paraplegia, strokes, and they're hemiplegic, paraplegic, but they manage to get back their function. Is because your brain was designed to heal itself. And the concept of that is plasticity of the brain. It's not always 100% that you're doomed because all of a sudden you find yourself paralyzed in a stroke or any kind of injury. Through hard work and through physical therapy and through taking things that promote brain healing and avoiding things in the brain that will be toxic, the brain can heal. For how much, we don't know. It just depends on how well somebody will be taking care of the brain. So they have proven that prolonged exposure to repetitive TMS, which is the other word for TMS because that's what it is, repetitive treatment. 5 days with a 2-day break, meaning all my patients, they get 5 days a week. They get the weekends off, but they expanded to 11 weeks. They have proven that it significantly increases brain-derived neurotrophic factor.